Hello, I'm Dr. Lauken, and I'm going to talk about choices related to radiation treatment if you've had a lumpectomy or a smaller invasive breast cancer and you're over 65. And if you're coming to see me for a radiation appointment about that, I look forward to our visit. So, we're going to talk first about the goals of treatment. And the most obvious benefit that we're looking for is to have the lowest chance of the cancer coming back in the treated area. And when we go further to look at the decision, we'll see that it's not a simple yes or no, black and white, radiation, no radiation choice. And the things that give us guidance are major, well conducted clinical studies. And there is a very best study for people over 65 that had small breast cancers, not more than 3 centimeters in size, and removed completely with no sign of spread to lymph nodes. They had what are called positive hormone receptors, and under the microscope, they couldn't be both high grade, that is, really aggressive cells, and invading little microvessels around the tumor. So these were good breast cancers. And in this study, half of the people had radiation treatment to the breast, and they also took pills, uh, so called endocrine therapy. The other half just took the pills, and they didn't have any radiation. And when these groups were followed for 10 years, we found that the group that had radiation to the breast and the pills had about a 1% chance of the cancer returning in the breast. If you just took the pills, there was about a 10% chance of the cancer coming back in the breast. So just to go over these important numbers, at 10 years, 0.9%, or just under 1% of people who had both radiation and the pills had the cancer come back at 10 years. And if they just took the pills, it's about a 10% risk of it coming back in the breast at the 10-year mark. And so when we look at that, we'd say, gosh, those are both pretty good odds, but 10% versus 1%, that looks pretty good. And so if the goal is to have the lowest possible chance that the cancer will come back in the treated area, the combination of those pills make it harder for cancer cells to use hormones to help them grow. The combination of those pills and the radiation is best. But to look at it differently, about 90% of the group treated with only the pills didn't have it come back either in the treated area. And someone would say, gosh, that 90% that's good enough. Now, if we change the goal and we say our real goal is to live as long as possible without dying of breast cancer, that's in fancy words, that we have the greatest breast cancer specific survival. Well, it turns out that the outcomes were the same whether the person had the radiation or not. And the idea is that, gosh, if you don't have the radiation and the cancer comes back in the breast, then down the road you could have more surgery and radiation and make up that ground. So it can be a reasonable choice to take these pills, so-called endocrine therapy, for at least 5 years, pills like tamoxifen or anastrozole or letrozole, for these small breast cancers that have hormone receptors and not bother with the radiation, accepting the higher 10% return rate of cancer in the breast as opposed to the 1%. So, what about results from radiation? And if we look at the current radiation prescription at 5 sessions of radiation to the whole breast, the kind of results from studies are a recurrence rate or a return rate in the breast at 5 years of about 1.5%, so 1 to 2%. And point out a bit of fine print that these studies allowed for a little extra radiation boost of 5 additional sessions to the place where the cancer was removed if there were certain risk factors. And also, the patients could take the pills if that was a mutual decision between the patient and typically their medical oncology physicians. And those would be the kind of people that I would tend to see it in my current practice. So it can be a reasonable choice to take the breast radiation alone for small cancers. It definitely lowers the risk of the cancer coming back. And if one keeps up with mammograms and so on, if it did come back in the breast anyway, one could have more surgery. So just to summarize, if a person over 65 with hormone receptor positive small breast cancer uh, looks ahead, they can have the lowest risk of the cancer coming back in the breast if they take both the uh, hormone treatment pills and the radiation. And if they take no treatment at all, they would have the highest risk of it coming back. And then they could choose the pills only or the radiation only for a risk level that is in between, but yet for most people, relatively low risk. So thanks very much for your attention to that. I hope, although it's a complicated area, that it was of some use to you.